This is just one of the many services created to support healthcare providers who prescribe opioids. For a better understanding of some of the new rules in effect, I'm joined by Dr. Mohab Ibrahim, Director of the Chronic Pain Clinic at the U of A College of Medicine. Dr. Ibrahim, thanks for being here.
Thank you very much for having me. It's a pleasure.
This is a fairly new program, just a couple of years. How is it for doctors to keep up so easily given that there's so much happening?
You're absolutely right, and that brings one of the main issues with medicine in general, which are the guidelines change quite frequently because science advances. And on top of that, we have new medications, new therapies. All this comes to us at a high speed. So it's very hard for someone who's not a specialized person in that field to be familiar with all the available technologies, new medications, and the new guidelines.
This has been a fairly short span of time, just about 2 years now. Any indication that this has caused some impact to the epidemic Arizona was experiencing?
I would say there is more caution now when physicians or prescribers reach out for that opioid prescription. The state, at least the state of Arizona, took some good measures in terms of the electronic prescriptions for opioids. It basically encouraged physicians to think about the consequences and also communicate these consequences with their patients. However, for some prescribers, this has been an old habit, and it's going to take some time to change habits. But there has certainly been a noticeable change.
It is fair to say that as a physician, you've had to take a look at what you were taught and how you've operated with consideration for your patients' needs and these new guidelines.
Yes, absolutely. I remember when I was in medical school, I graduated, I think, 2008. The message we got in medical school at that time was, if you prescribe opioids to a patient in pain, it will be very unusual for them to get addicted. And we knew this was not accurate based on animal studies or based on the patients that we saw in clinics. So it has changed now. Education in medical schools has evolved, and now there is bigger concentration on pain education, just because there is more visibility now to the issue of pain management. Again, it's still sometimes a difficult message to share with patients and honestly even with some physicians.
Would it be appropriate to say there's been some level of frustration for physicians in this new role?
Yes, because let's assume, for example, that I'm a surgeon. I'm not, but let's assume that I'm a surgeon and I do invasive surgeries that require basically a very involved surgery, which I know the patient will be in pain after surgery. So the guidelines basically stipulates that the initial prescription has to be 5 days long for acute pain or post-surgical pain. Now, as a surgeon, I can get confused because I know from previous surgeries, from my experience, that given the intensity of the surgery, given how involved the surgery was, the patient might be in pain for 2 or 3 weeks. That means in 5 days they're going to come back to the clinic to see me so I can give them a refill or another prescription. There are no restrictions on refilling the prescription, but that means now it takes time from my clinic to see a patient that I know it's probably not the best time to see him or her yet because they're still in the recovery phase. So that might be a little bit confusing point. What's also may not be very well known is that physicians can still prescribe what they think is the appropriate amount of opioids, but there has to be significant documentation or very clear documentation as to why they're prescribing out of the guidelines. And at the end of the day, it's guidelines. So we have to keep that in mind.
So the responsibility then lies with the patient or the physician?
With both. So expectations is the key word. So someone comes to have surgery, the expectation is, I will try to make that person as comfortable as possible. However, it's it's good to deliver the message that, yes, we're going to do the surgery. Unfortunately, it's going to be uncomfortable, but we're going to try to keep your pain under control. It's unrealistic to make someone pain-free.
Okay. All right, Dr. Ibrahim, thank you.
Thank you.
A reminder, you can see all of Arizona Public Media's coverage for Arizona Addicted online. Visit azpm.org/Arizona Addicted. We also have information about resources available to help those impacted by the epidemic.